former Vice President of the United States, Joe Biden.
Thank you. Thank you, thank you, thank you, thank you. There's no group of people I'd rather be with, and I mean that sincerely. Unfortunately, probably all of us have one thing in common. That is either we personally or someone we love, care deeply about, has had that C word uttered to them somewhere along the line in their lives. And I say at the outset, and I mean this from the bottom of my heart, I can't tell you how much I appreciate, presumptuous of me to say this, but how much I personally appreciate as the father of a son who lost his battle to cancer, how meaningful your focus on the patient is. You know what, a lot of researchers, and they're brilliant researchers, and they devote their lives to dealing with the dreaded disease, but a lot of really brilliant people don't fully understand the sense of urgency, the desperate need for hope on the part of the patient and those who love that patient so much. And what you do more than any organization in the world is you give a sense of hope, even if it's just one more day, one more week, one more month. Doc, just give me 2 more months. I want to walk her down the aisle. Or Doc, so you guys get it. You guys get it. You not only intellectually understand it and do something about it, it's in your heart, and it matters. It matters, it matters, it matters. I want to thank Kim and the cancer support community for having me here tonight and giving me this award. I don't deserve the award. I'm just a survivor of this god-awful experience like so many of you. But you should realize, and I mean this sincerely, I have literally traveled the world. I've met with thousands upon thousands of cancer researchers. I have met with clinicians. I've met with more than a half a dozen, actually 9 or 10 Nobel laureates. I've traveled the world from Melbourne to Mumbai to, and visit every major cancer center in the world. And we have a national treasure here in Kim. And I'm so grateful for her counsel that she's provided me as a member of the team of the Cancer Moonshot, and for framing how we continue this work going forward. You know, all of you are here tonight because I said you've been there for patients, and many of those patients have been people that you've loved dearly from all across the nation. And I thank you for that commitment, and thank you for staying engaged. You know, my involvement in this fight has been driven by deeply personal experience, like many of you, and I'm sure this audience understands that better than most. And throughout my Bo's diagnosis and treatment, as anyone does when a loved one is facing a deadly disease, my family and I tried to learn as much as we possibly could from the talented doctors, nurses, and professionals we encountered and I had access to because I had the advantage of being vice president. And above all else, we learned a lot, but we learned, and I'll repeat it again, that the single most important ingredient to someone facing a very difficult diagnosis is hope. If not for my Bo, for someone else's son and daughter, the hope that they will never suffer the same consequences from the disease as my beau did. And I know some of you have had the same experience. On so many levels, we've reached an inflection point in science and technology. But this Cancer Moonshot was as much about, much more than about research developments. It was about bringing the best knowledge and tools we have to all communities across the United States, not depending on what your zip code was. It was about making sure that prevention and early detection reached neighborhoods. It was about reducing disparities in care that still exist today. And it's about putting the patient at the center of our solutions, and at the center of their own care, The point I'm making is, this moonshot has turned into a mission, not me. There's a new sense of urgency. I also concluded that the moonshot should be fundamentally focused on two things after the 6 months of traveling the world. One, injecting the urgency of now in this fight. The goal of doubling the rate of progress, to do in 5 years what would otherwise take 10. I believe with every fiber of my being we have that capacity if we start to play well in the sandbox together. Secondly, to change the culture. Come up with a new strategy for this fight, not the last war, this new fight. Cancer research and care system was set up, as I said, decades ago. There was little, if any, sharing with hospitals and researchers. There was little ability to share. And so we have to update the strategy for the 21st century, one that is more interconnected than you could have ever imagined. There's a renewed momentum, and with that, a renewed hope. Apart from what we did in the White House, there was a real excitement around the country to be part of the moonshot. Organizations and companies around the country created new partnerships, none more than the cancer support community, and injected into the fight the American spirit, the notion that we can do anything. Those of you who are closer to my age remember when we were coming up, there was a notion in America, there's nothing we can't do. I mean that literally. And so we've injected again into this fight this spirit, this notion of possibilities. It's been contagious. New partnerships are formed to identify and implement culturally appropriate cancer education and outreach efforts to reach people where they are, where they live, in the language they understand. Others identified cancer survivorship issues, and we're working to develop solutions to improve health outcomes for cancer survivors because, as you know better than anyone, the medical and psychological and economic challenges facing cancer patients don't end with the end of treatment. I'm optimistic. We can do this. We can do this. But only if we come together and break down those barriers and bring the best available care to patients no matter what their zip code is. And we continue to need your help and involvement because you know what you all do? You prick everyone's conscience. Not a joke. You prick their conscience because your focus is about the patient. But as so many of us know from personal experience, at the end of the day, it's one patient at a time. It's not a statistic, it's a patient. Someone needs to be there with that cancer patient, with their loved ones, to bring all this together. And that's you guys. That's you. You have to gather all the light we're trying to shine on better treatment and better access and focus it on the individual patients. You look out for these folks. You know they need help. No one knows better than this community that what a patient and their family needs more than anything for the third time is hope. 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 Hope for another day. Hope for another moment. I'm not joking. You've been through it. I don't know how many patients, including my son, said, I don't expect you to make me live, doc. But can you give me just a little bit? Just a little bit. Just a little bit more time. That's what makes this cancer support community so important and meaningful. You're the people who always put the patients first. You bring care to the patients you serve. I can't, the nation can't. I can't thank you enough for the incredibly important work you do. And if you'll have me, I look forward to continuing to work with you. God bless you for what you do, and may God protect our troops. Thank you. I'm sorry it takes so long.